Hello and welcome to another episode of Hope for Today. I'm Dr. Michelle Hamilton, your naturopathic medical correspondent. In today's episode, we'll be reviewing the developments of COVID 19 cases in children. Now, since mid April, several reports have been circulating about a mysterious illness in children. The condition is called multisystem inflammatory syndrome. While it is important that we are aware of these incidents as parents, there is no need for alarm as the condition is very rare. However, if your child displays any symptoms not related to a previously diagnosed condition, it is important to visit your pediatrician. Now, there have been a few cases in Italy, Spain, the UK, and the USA. A few deaths have occurred, and most children with these inflammatory symptoms have tested positive for COVID 19. The syndrome has been described as having symptoms similar to Kawasaki disease and toxic shock syndrome. Now, Kawasaki disease is something that is rare and affects many organs in the body, including the skin. It is still unclear how exactly the syndrome is related to coronavirus. As parents, worry is understandable. However, if your child has symptoms such as a high fever, a rash, swollen hands or feet, redness in both eyes, contact your pediatrician. The Centers for Disease Control has published an advisory as a guide for doctors to know what to look for, and we are keeping abreast of these symptoms. Some of these symptoms include individuals who are under the age of 21 who present to us with a fever and laboratory evidence of inflammation. And also, if the sickness is severe enough that they require hospitalization, we will note that there are at least 2 or more systems involved, which can include the heart, the kidneys, the respiratory system, the GI system, and also skin. And this would be away from any other plausible diagnosis. We will also be seeing or checking if they have tested positive for COVID 19 or have been exposed 4 weeks prior to the onset of these symptoms. Again, we would also be looking for temperatures elevated over 38 degrees Celsius or 104 degrees Fahrenheit. Additional blood tests would also help to inform us of inflammatory markers in the body. However, thus far, many of the cases, approximately about 150, have been in the New York area, and they're currently doing checks in about 18 states on suspected cases. We will be providing you with updates based on reports on this new illness over the next few weeks or as information becomes available. In the meantime, let's focus on a few reminders to keep your children safe and virus-free. Now, first of all, do not put cloth face covering on young children under 2 years of age. Try to avoid your children sharing food or snacks with neighbors. Instead, you know that they want to socialize, so plan with parents and have a play date with 2 or 4 close friends or family members at home where they can be supervised. Have them sit outside and you share the snacks in separate containers for them. We do know that children are also experiencing bouts of sadness from not being able to play with their friends, so this is very important. Remind them to wash their hands before eating and after using the bathroom. Parents, many of you have children with sensitive skin and conditions such as eczema. The frequent use of alcohol-based hand sanitizers can dry their skin and worsen conditions such as eczema. So instead of the hand sanitizers, simple soap and water is sufficient to wash the hands, keeping them clean from viruses. In addition to washing, also moisturize their hands after washing. I would prefer if you use a pump bottle with the moisturizer to prevent cross-contamination of creams. And finally, remember, children are a heritage from the Lord, an offspring or a reward from Him. Like arrows in the hands of a warrior, are children born in one's youth. Blessed is the man whose quiver is full of them. Thank you for joining us on another episode of Hope for Today. I am Dr. Michelle Hamilton, your naturopathic medical correspondent.